I'd like to thank my colleagues Nisim Rubin and Dylan Edelman of AJC's Asia Pacific Institute for their dedicated efforts to round out our panel and also to make sure we had all the support that we needed. And a special thanks to my Assistant Director, Danielle Cohen-Schrager, whose efforts have been central to making this morning a reality. And now it's my pleasure to welcome Consul General Israel NITZAN of the Consulate General of Israel for a few opening remarks. Consul General NITZAN, before I turn over the floor to you, I do want to thank you for your continued friendship with the New Jersey Jewish community and with AJC and AJC New Jersey. You have certainly been a great friend of ours and it is deeply appreciated. I turn the floor to you.
I think that this event is a celebration of friendship between three great democracies. The world's greatest democracy, the United States of America, and India, the world's largest democracy. And we have a new challenger today, Israel, with already 3 election rounds in the last less than 2 years, and we're already speaking about the 4th one. So I think that at least we can challenge we can join you in the leadership for being a vivid and active democracy and a leader in the democratic world. But seriously, the special relationship between the 3 countries and nations are based on deep shared values of freedom and democracy, with a special role that we have, each country and each nation in history, that goes beyond any national or strategic interest. There is an additional component here, a significant contributor, especially to our bilateral relations between Israel and India, which is the long-lasting relationship between the American Jewish community and the Indian American community. The brotherhood between these communities, based on, again, shared values of excellence and education. We have a lot of doctors here, and I can speak about especially the role of the Jewish mother. I'm sure that the doctors could share and say that maybe there is. I'm sure that there could be the same could go also to the Indian community, I'm sure, and of course the value of pluralism, which these communities played an important role, not only in the establishment, but also the development of the Israeli-Indian alliance since 1992. I've been here for 2 years, and I can tell you that the relationship between the communities and the consulates are a very solid basis for these bilateral relations, at least here in New York. And I also want to mention, again, the role of organizations like the American Jewish Committee, and of course, it's the AJC's CEO, David Harris, in actually contributing, strengthening these bonds. The story that we'll share here with you today is, in essence, is what Israel is all about. And it's also, in essence, what India is all about. And it's also a central value in American Judaism, which is tikkun olam, repairing the world. And I want to thank you again for joining us today. And I hope this story will serve us all to strengthen even more the bond between our communities and the kinship between our countries. And I thank you again for hosting this event, and all of you for joining us. Thank you.
Thank you, as always, for your friendship. It's now my pleasure to welcome to the screen Ambassador RANDHIR JAISWAL, who should be on with us in a moment. Ambassador JAISWAL assumed charge of the Consulate General of India in New York just this past July. And so it is a pleasure to welcome you, Ambassador, to the tri-state area. It's really an honor to have you with us so early in your tenure here. And as I said, a pleasure and an honor to welcome you to the tri-state area on behalf of both AJC and AJC New Jersey. As you know, we have enjoyed a long and warm relationship with your consulate, including an annual Indian Hanukkah celebration at the consulate. And we look forward to continuing that relationship with you during your tenure here. So again, welcome, and we turn the floor to you.
There are 4 areas in which, and I'm sure Ambassador MALKA would talk more about it, but there are 4 key areas in which we've gotten together. One, of course, is trying to give a helping hand to each other in the area of PPE kits. We supplied PPE kits to Israel when there was a need earlier during the year. And Israel, we were happy to receive ventilators from Israel for the state of Tamil Nadu when we needed them. The other, of course, important area, which is the topic of discussion today, is the area of diagnosis. This new testing capacity that is coming out of Israel has huge potential, to test COVID results within less than a minute, 30 seconds, as the case may be. We had a team which recently visited India. They've taken a lot of samples. It is an ongoing effort, but we are confident that with all the great minds that are there and with the commitment that we have for this relationship, for this friendship, we'll do better for ourselves and for the world at large. The other area, of course, where we are pooling our resources and our minds is how to develop new tools for forecasting a pandemic, or looking at or forewarning ourselves about the second wave of COVID-19. There, of course, new age technologies such as artificial intelligence are being employed, and we think there is a real possibility that we can do something good for ourselves. And of course, the 4th area is vaccine development. India today produces 60% of the vaccine of the world. There are a lot of efforts, global efforts ongoing to produce a vaccine for COVID-19. There are several therapeutic attempts also being made. Whatever happens, when you need the scale, India is there to support. We have a large manufacturing capacity, and when it comes to scaling up, I think the Indian backbone of the pharmaceutical industry, of the vaccine development industry, can come forward and support global efforts. So all in all, it's a happy story. It's a very innovative story. And I must tell you, when we were in India, Prime Minister Netanyahu had come on a state visit, and during his meeting with the president, we had served him Indian tea infused with olives grown in Rajasthan with the help of Israeli cooperation. It was very well appreciated. It had a different aroma, the aroma of Israel and India together, and it was very exciting, very innovative. This particular seminar and the effort that we are in right now, can 30 seconds change the world through a new testing capacity, has or will have and has the same excitement, the same innovation. I wish the effort, and to all our friends who joined here, the very best, and I look forward to the discussion. Thank you very much, sir.
New Jersey has one of the largest Indian diaspora communities in the country, and we look forward to connecting you through our Hindu-Jewish coalition with that community and our community as well. It is my pleasure now to introduce this morning's distinguished panel. Our panel today includes Ambassador Ron Malka of the Embassy of Israel in India, Dr. SUDHAKAR JONNALAGADDA, President of the American Association of Physicians of Indian Origin, and Dr. JAGDISH GUPTA, AAPI's Mid-Atlantic Regional Director. Moderating their conversation will be Dr. SUDHIR PARIKH, Founding Chairman of PARIKH Worldwide Media and Secretary of the American Association of Physicians of Indian Origin. Ambassador MALKA, who should be on with us in a moment, will open our dialogue on the groundbreaking research that is emerging from Indian-Israel cooperation.
Our scientists that has been a long time under mutual trust and mutual respect decided to focus on rapid tests for COVID-19 because we realized that it will take time until we find a vaccine and until we'll manage to immune all the population. And until then, we need to find ways to enable the economy to function and to balance between, from one hand, the effort to avoid the infection as much as we can, but from the other hand, allow the economy to go on. And rapid tests that will give us results within a few seconds, can be a game changer. So we tried many technologies, tens of them. And what we wanted to see is technologies that we can collaborate for sensitivity, technologies that will be sensitive enough to distinguish and find, so to speak, fingerprints of COVID-19, even in mild cases from one end, but will be specific enough. And this is a collaboration for collaborated for a specificity to be able to distinguish and identify the COVID-19 and distinguish it from other coronaviruses or any other viruses. So eventually we find 4 technologies that under laboratory testing were very promising, and working on these technologies, the joint collaboration, the research started between Israel and India, and we got to the stage of testing. We start tests in Israel, and after that we came to India to upscale the sample and to take as much samples as we can. And this process, this joint research really accelerated this research. And what usually takes months and sometimes years, we accomplished within a few days. And within 9 days, we managed to take 20,000 samples of these 4 technologies. The technology that we came to the final, those that we are working on, are a voice test. Yes, it excites the imagination, but we ask the person that is being tested just to speak. And using artificial intelligence and big data analysis, we're trying to find this, so to speak, fingerprint of COVID-19. The second technology is high frequency. We project on the sample high frequency, terahertz frequency, and again, trying to find the specific fingerprint of COVID-19. Another technology is isothermal technology test. Eventually trying to manipulate the temperatures and again find this fingerprint of COVID-19. And the last and the fourth technology is polyamino test, trying to find the proteins that are related to COVID-19. So we tested all these technologies, and now all the samples are being analyzed. We are amidst this process, and within a few weeks, we'll be able to know if one of or maybe more of these technologies will give us the results that we are looking for. It might be one or any joint technologies, maybe 2 or 3 of them, but eventually what we are trying to do is to have a test that will be conducted locally, which makes it also very cheap, and will give the results within seconds. We named this operation Open Skies, because the first thing that we'll do is open the sky if we have this technology's ability to have results within a few seconds. And of course, it will enable us many things that we cannot do now, like conferences, all kinds of events and meetings in person that we are now avoiding to do. So as I said, those samples are now tested and analyzed. Again, it's a joint research. We're talking every day. Our scientists from both Israel and India are working every day, analyzing the results and whatever they do, using, as I said, big data analysis, a process of machine learning. These processes progress, they're progressing themselves as much as we have more data and more samples. So it's, they're using a machine learning technology, and hopefully within the few weeks, at least one of these technology will give us the results that we are looking for. I can even now say that this operation was very successful, even before we get the results, because we managed to get all the objectives. It was a very ambitious operation to come here and within 9 days to take 20,000 samples. It's not something that you can do every day. It really needed a commitment and the dedication of both sides of scientists and all the other people that helped us to do this. It was a joint effort that was very successful. And as I said, we managed to meet all our objectives. I would like to mention that in addition to that, what we did was This special flight that came with scientists, we also brought as part of our collaboration and strengthening friendship, we brought all the advanced medical equipment that was invented especially to fight COVID-19 in Israel using the latest technologies. So what we did, we got a list of the equipment and technologies that were used from the Ministry of Health. I myself went with experts to our leading hospital, Tel HaShomer in Tel Aviv, and all those equipments that were found useful and efficient were collected and brought here to India, and we shared them with Ames Hospital, and whatever will be found useful will be upscaled to India. This is the way that we share between us all the achievements, the technologies, best practices that we do. And as I mentioned before, we also brought very advanced respirators to India. Then the second shipment is now on the way. Another shipment, the first time we brought 83 advanced respirators to Tamil Nadu, but now more 122 from these advanced respirators are on the way from Israel to India. And what is special about these respirators that are export banned in Israel, because it's fighting now the second wave of this pandemic, which is even worse than the first wave. But still, this is the reflection of the strong friendship and commitment between our two countries. And this is exactly the time to thank again the Indian authorities that were there alongside Israel when we needed, when the pandemic just broke out. We needed to evacuate thousands of Israelis from all over India. And we got all the assistance and the help from the Indian authorities, from MEA, civil aviation, and all other authorities and state governments. And all these thousands of Israelis under full lockdown and closed skies got back safe home. They all got back safe home, and we are very thankful for that. India also provided us medicine and raw materials for medicine, protecting gears. And I think this is the reflection of a strong friendship that is based on strong values. So I can conclude with that under this pandemic, the friendship between Israel and India that was very close is getting even closer and stronger. And whatever we do now will shape the way of our collaboration in the future, and it looks very, very good. We are looking for more initiatives like this scientific project, working now on more technologies and more solutions. Since, as I said, this collaboration was very successful, we are now exploring new solutions for other challenges.
Good morning in the USA, friends in USA. Good afternoon, friends in Israel, and good evening, our friends in India. Ambassador Ron MALKA, Honorable Consul General JAISWAL, Honorable CG of Israel NITZAN, Consul Wichensky, and dear friends all over the world. I'm Dr. SUDHIR PARIKH, Padma Shri recipient and Secretary General of Global Physician of Indian Origin, which represents 1.2 million Indian physicians outside India. At onset, I would like to thank my friend Nissim Rubin from AJC for inviting me and my colleague from the AAPI to speak. Nassim and I go a long way for last 20 years. We met first time, Nassim, in 2001 at Honorable Prime Minister Narendra Modi's home in Gandhinagar, where that time he was the CM of the Gujarat. Both of us know Honorable Prime Minister personally. He fondly calls Nissim India's Rashtradut, a goodwill ambassador to Jewish world. Since 2002, Nissim has had significant role to play through his work at AJC, building strong Jewish and India diaspora relationship, and advocate for close ties between the US, India, Israel in the strategy of economics, technology, and cultural areas. India recognized Israel in 1950, but it was only in 1991 that India upgraded to a full relationship with the State of Israel. Through those years, or even more so today, the Indian American community has been a passionate advocate of close ties between India and Israel, India and USA and Israel. Since the 60s, when many of us started coming to USA, we used to request every visiting Indian Prime Minister and foreign ministers to upgrade the relationship with the Israel, which will benefit India tremendously, especially in the area of health, agriculture. Through those years, the one congressman from the India caucus was late Jewish Congressman Steve Solaz, our good friend, who used to join us for meeting with the Indian prime ministers and Indian foreign ministers who were visiting New York City. And agriculture, defense, and health cooperation have become the three pillars of the close ties between India and Israel. My home state of Gujarat was among the first state government who sent the delegation to Israel to learn Israel's ability to make desert into the green land through water management and conservation techniques. We in the Indian American community, medical community, would now like to help regular exchange of the expert in the health sector between India, Israel, and command both the Prime Minister, their scientific advisors, ambassadors, Ron MALKA, and Mr. Singla, of making this happen with the large Israel delegation setting up a 2 weeks COVID testing camp in Delhi. A few on this call might remember that in the aftermath of the massive Kutch earthquake in Gujarat, in my home state in 2001, myself and Nissim, we both had a privilege and honor to be a delegate in the President Bill Clinton's delegation to India. And Israel, even the smallest country of the world, had a largest mission of 300 doctors, nurses who stayed in the Kutch in the massive field hospital. They set up for all the months. And Nissim Rubin, who served there, one of the main local coordinator, described the mission to us, and where our Israeli friends brought every equipment from the Israel and request a local authority for regular supply of the diesel. Many surgeries were performed in that field hospital. Few babies were born during that time. And one of the babies' name, we kept it as a Israela. Is a secretary of Global Association of the Physicians of the Indian Origin, which represents 1.2 million Indian physicians outside India. Both myself and American Association of the Physicians of the Indian Origin, President Dr. SUDHAKAR, advocate with our US government to foster the closer cooperation in the health and disaster management sectors between the US, India, and Israel. Before I invite our panelists, let me say that briefly that I'm our private practice in New York City. We are one of the investigators in the vaccine development, which is Moderna vaccine, which is in the third phase of the trial. And there are other vaccines from the AstraZeneca, Pfizer, as well as from the Johnson & Johnson. They all are in the third phase of the trial, and hopefully we'll get the vaccine before the end of the year. And that will change our challenges in the pandemic. Now, I would like to invite AAPI President, Dr. SUDHAKAR JONNALAGADDA, and AAPI Mid-Atlantic Director, Dr. JAGDISH GUPTA, to make brief remark. We will then be glad to hear Ambassador Ron Malka's recommendation and suggestion, I convey our Indian American community's warm regards to Ambassador Ron Malka, Honorable Consul General RANDHIR JAISWAL, Honorable Consul General Israel NITZAN, and Consul Vilchinsky. Before I turn over to Dr. Sudhakar, I would like to ask one question to Dr. Ambassador Malka. That we know that Israel has set up 29 centers of the excellence across the India to help the Indian farmers to learn the best Israeli expertise in agriculture. So we hope and we wish that Israel will also establish such a center for excellence in health throughout the India, particularly in the rural area, to help the Indian population. So after our panel comments, I would like Ambassador Malka to address this our question. Then I have another second question to Dr. Sudhakar, that we in the past AAPI took the delegation to Israel, and I think we should continue AAPI delegation to Israel and also join the US-India and Israel healthcare dialogues to make it more stronger. And one question, last question to Jagdish Gupta. Please, you can address this answer in your remark that Gupta, you are from the AIMS. AIMS is a very premier institute in India, and would like to have more, how to make more stronger relations between the AIMS and other pharmaceutical companies and the Israel government. So let's, I would like to hand it over to Dr. AAPI President, Dr. Sudhakar. Dr. Sudhakar.
Thank you, Dr. Parikh, and good morning, US, and good afternoon, Israel, and good evening, India. It's my distinct honor to join today's panel discussion. Ambassador Dr. Ron Malka, Ambassador RANDHIR JAISWAL, Acting Consulate General Israel NITZAN, and Mr. Nissim Rubin. On behalf of American Association of Indian Origin, representing interest of more than 100,000 doctors, and we're pleased to co-sponsor this important event with the Consulate General of Israel, the Consulate General of India, and the American Jewish Committee Asian Pacific Institute, the New Jersey Israel Commission, and the New Jersey Hindu Jewish Coalition. As you know, the religious ties between India and Israel stretch back into antiquity. When the Jewish people faced persecution, they could always count on the people and government of India to enable their personal religious freedom. India's rich religious history, peaceful coexistence, has been strengthened by many centuries of partnership between Jewish and Hindu communities living side by side in India. In recent years, we have seen expanded tourism, defense cooperation, and healthcare research grow between India and Israel. Health cooperation, especially in light of current global pandemic, is critical not just for the people of Israel and India, but for the entire international community. Israel has donated advanced medical equipment to India, while India has supplied Israel with medicine and personal protective equipment. Joint efforts between both allies are leading to success in developing rapid coronavirus testing along with therapeutics. Developing rapid COVID tests is one of the keys to successful unlocking the Indian and Israeli economies while following the best practices in managing public health. We can quickly find out who is positive, conduct contract tracing, and provide them with the most effective therapeutics to successfully treat patients across Israel and India. Together, we can save lives while our scientists develop a vaccine, which India has already promised to provide countries in need around the world. In this time of crisis, India and Israel health cooperation will play a critical role that will ultimately benefit millions of people across both nations and around the world. It is a partnership that we should be immensely proud that we are immensely proud of that. We are glad our friend Nissim Rubin invited us to speak at this important program. On behalf of AAPI, our best wishes, gratitude, support to Ambassador Ron Malka, and looking forward to meet Sanjeev Singla, Ambassador from India to Israel, and Consulate General RANDHIR JAISWAL, and Israel Consulate NITZAN, and Consulate Adwa Vilchinsky. And God bless US, Israel, and India.
Thank you, Dr. Sudhakar. Now I would like to invite my close friend and Mid-Atlantic AAPI, American Physicians Association, Mid-Atlantic Regional Director, Dr. Jagdish Gupta. Dr. Jagdish.
Good morning and Shabbat Shalom to all the listeners across the globe. I am very privileged and honored to bring greetings from the Board of Trustees of American Association of Physicians of Indian origin to His Excellency Ambassador of Israel to India, Dr. Ron Malka, His Excellency Consul General of Israel in New York, Mr. Israel NITZAN, and our very own His Excellency Consul General of India in New York, Ambassador RANDHIR JAISWAL. I am also very happily extending our greetings to Nisim, who's been a good friend over the years, and also Consul Edward Kulczynski. As an alumnus of All India Institute of Medical Sciences, LEVY, class of 1966, I moved to New York in 1972. I am very grateful to Israel as a country and His Excellency Ambassador Dr. Ron Malka for sharing the best of Israel's medical technology and donating the equipment to our leading medical institute in India, All India Institute of Medical Sciences. This was an act of great cooperation between two countries. As an Indian physician in America, I am very proud of our scientific community and our government in India for their scientific and technological cooperation that can help Israel and India, along with the entire world, deal with this epidemic and help relieve the human suffering, along with improving the economy of the world. I'm grateful to Dr. JONNALAGADDA for sharing this platform with me, and I'm very thankful to Dr. PARIKH, the General Secretary of GAPIO, for moderating this session. As for the relationship to his question between India and as alumnus of All India Institute of Medical Sciences, the cooperation between the Foreign Ministry and AIMS began in 2007 when I was the chairman of the AIMSonian group in America, celebrating the 50th anniversary. As you all know, All India Institute was the vision of our esteemed Prime Minister Jawaharlal Nehru and started in 1956. With this cooperation, when the Indian hospital approved the construction of a trauma center at All India Institute of Medical Sciences based on Israeli model, and that became operational in 2011 when I was the president of the AIMSonian group in America of 1,000 physicians of All India Institute of Medical Sciences alumni. The University of Florida also helped us in deciding a course over there, which the alumni helped. It is a matter of great cooperation between the two countries for donation of the medical equipment developed for combating, as outlined by the Honorable Minister, Ambassador Ron Malka, in 3 or 4 fields. The testing which was developed with the 9 days trip to India and collecting 20,000 samples is called the point of care testing. And it is an antigen-based testing which can identify the 6 antigens which are present in the coronavirus, coronavirus 19, virus. And these antigen can be recognized when 2 or more antigen are recognized by the rapid test. The test becomes very, very specific. And the specificity of this test is what we are looking for to be determined by the data which has been taking place. As our GAPIO secretary mentioned and our Honorable Ambassador JAISWAL mentioned, the cooperation between the two countries is not only at the medical level, which has been going on, it is also at the agricultural level, which was mentioned by Ambassador JAISWAL, and at the defense level. I think at the present time, India-Israeli relationship in the defense level is of the very significant proportion. So with all this thing going on in the pandemic, we are hoping for a greater cooperation for the benefit of not only India and Israel, but for the entire world, for the economic advantages those rapid testing would bring in. And I'll close my remarks with that, with sincere thanks to every listener for listening to this. Thank you.
I would like to request Dr. Sudhakar to answer a question I posed to him before his remark. Dr. Sudhakar.
AAPI, really looking forward to visit Israel, for particularly being a health organization. We would like to learn more technology from Israel. As a gastroenterologist, I use the technology to study the small intestine with a capsule with camera, which is Israel technology. And also very important to partner with, so you can visit the country and learn what the new technology Israel is doing, and also especially the disaster management is very important. I think, these two things, and AAPI leadership definitely looking into this, and would like to travel to Israel and learn everything what the latest advances in Israel.
Would like to request our ambassador to comment on our wish of establishing Center of Excellence in the Health in India by government of Israel. Sir, can you comment on that, please?
Well, I think it's a great idea. Since I started my post, one of the first things that I did, since I understood that India is going to take one of the biggest, I say not reform, even a revolution of medical care to the first stage, more than 500 million people. And since Israel has so much to share and to give, and Israel is keen to share. I met Dr. Indu Bhushan, which is the head of this mission, Ayushman Bharat. And I recommended just that India should focus on telemedicine, remote control treatment with different centers of excellence in different places. And I think this kind of net can be the holistic solution for medical support to all the population. And Israel is keen to share and to do this. As you mentioned, like our very successful mutual agriculture project, we have now 28 functioning centers of excellence. Only 1 year, 147,000 Indian farmers were trained in these centers of excellence. It's so successful. It's the most successful mutual project, agriculture project that we have with all the world. We are now going to expand it to its next stage, which is centers, and that will expand to areas of excellence, villages of excellence. We are going to nominate a water attaché in the embassy in Israel to join the agriculture attaché in order to bring the Israeli model, which is a holistic model that is dealing with agriculture and water together. We don't do the distinction. Also energy together. So we are going to bring this model. This is on the agriculture and water side, but also with healthcare. I think that there's a lot to do. Israel is keen to share, and as GUPTA just mentioned, we are in close relations with AIMS Hospital, All India Institute for Medical Sciences. I've been there myself. I brought all the equipment, the latest developments of medical equipment that we use for fighting COVID-19, and we brought it to AIMS and we shared it with them. Even, just example, robot, medical robot, they can really do so many things, not only monitoring, but even part of treatments, and really minimize the exposure of the medical staff to the patient, which is so important now in fighting COVID-19, and other remote control treatment medical equipment that we brought here to AIMS. And I think this will be the start of building those centers that you've just mentioned that will enable us to treat and monitor patients from distance. I think this is a very good idea, and we are looking forward to do that.
Our first question is, How has COVID affected those in extreme poverty in your respective countries, and what are you doing to support these people? So Ambassador Malka, could you speak first about how COVID has affected Israelis, and then I will pass it over to the doctors to discuss how it has affected Indians.
COVID has really affected all parts of the society, and especially those that are more vulnerable, those that have less means. And what we are doing in Israel as a society, we're supporting each other. And what we did is different schemes that were focusing and giving more, say, priorities to those that suffer most and need more help and assistance. So we had some stages of different schemes that supported the population that needed more support. And I think that now we managed to get to each and every one of the population that needs this support and help, and we are trying to do the best. And it's an ongoing process. It's a trial and error, because dealing with this pandemic, we have so many things that we're just learning through the process. And we're just trying to advance and to see what are the best practices and to change and improve them on the way. So I think all the population was affected and influenced, so not infected, but influenced. And of course, we try to bring the support to each and every one of.
Thank you so much. Doctors, could one of you address, please, how COVID has affected those in extreme poverty in India and what is being
Yes,
addressed?
Dr. Parikh here. I think India has done excellent management and control of the COVID-19 situation. Since, as you know, that India is very highly populated, 1 billion plus people with the crowded living condition, and sometimes living society is also very crowded. And even in spite of that, because of Honorable Prime Minister Modi has started early lockdown, strict lockdown, and great education to the people of India. So the number of cases, number of deaths is only 1.7%, and the number of recovery is almost about 75%. So India has done really a great, remarkable job in challenging the pandemic, in spite of all India's challenges as a crowded place, lot of populations, poor populations, little less educated population. But I think all credit goes to Prime Minister Modi and his team for doing the excellent management. And we would like wish Prime Minister congratulations and kudos to him for all this great outcome of the pandemic situation.
Dr. Jagdish Gupta, the biggest slum of the world is Dharvi in Mumbai, in India. It has the densest population, and even in there, the incidence of pandemic COVID-19 incidence is very, very low. It is probably the best reflection of how Indian government has handled the pandemic in the densest and the poorest.
This is Dr. JONNALAGADDA. I agree with other panelists. Early lockdown by the Prime Minister Narendra Modi ji is very, very crucial in Indian pandemic point of view regarding COVID. Definitely, the new antiviral which they are manufacturing and using really helping the community. And we don't exactly know whether India is a malaria belt, mostly. This chloroquine helping them, we don't know. Or BCG vaccination helping them, we don't know. So definitely the intensity of disease was not that high in India compared to the rest of the world. So again, we had to appreciate the Prime Minister Modi's decision of early lockdown really helped the country tremendously. Thank you.
My good friend Andrew Gross, the Executive Director of the New Jersey Israel Commission, with us this morning. One of the untold stories, if you will, Andrew, before you begin, is recognizing the very unique relationship between New Jersey's Jewish and Hindu business communities and their connection to Israel, India, and New Jersey. When you first began your job, you came to AJC New Jersey to ask about connecting with those communities, and you met with leaders of AJC New Jersey's Hindu-Jewish coalition very soon thereafter. And that was an amazing meeting, and it's with that in mind that we were so happy that you're able to join us this morning. So Andrew, I'll turn to you for some closing remarks on this very special relationship.
Absolutely. So first of all, thank you so much. And it's really a pleasure to join, and I'll keep my remarks very brief. I want to, of course, acknowledge, like many of the guests have, Acting Consul General Israel NITZAN, my friend, who I worked with for many years. It was great to see him this morning. And of course, a very special welcome, if I may, Rabbi, just a second, to welcome Consul General JAISWAL to the United States, to the New York metro region, and particularly Consul General. Really hope that you have an opportunity to visit the great state of New Jersey. And on behalf of Secretary of State Tahisha Wei and the New Jersey Department of State, please allow me to express our welcome to you and our appreciation for your special relationship with the state of New Jersey. And of course, Ambassador MALKA, I don't know if we've had the chance to meet, but it's great to see you this morning, and all the guests who have had such wonderful things to say. You know, as Rabbi, as you said, I believe, and in my capacity, so people know, I oversee the largest state commission for the state of New Jersey, 85 members of the New Jersey Israel Commission, and we're the only state in America that has a state commission dedicated exclusively to relations with the state of Israel. And most of my work involves trade and economic relations, but of course, cultural relations, and of course, you know, areas like medical cooperation, which we spoke today, are so critical, really, when we think about how terribly New Jersey was affected in the United States and like many places in the world by COVID-19. I believe, Rabbi, and I think this is true credit to AJC, that New Jersey is the crossroads of America when we are talking about the United States relationship with both India and Israel. It's a fact that not only does New Jersey have one of the largest Jewish communities in the United States of over 500,000 people of our 9 million strong community, but that the Indian community is also one of the largest communities that we have. A lot of people don't know that after English and Spanish, Gujarati is actually the third spoken language of the state of New Jersey, and we have the fourth most Israelis of any state in America. So it's so natural and so obvious that our communities should work together, are working together now. And in fact, Governor Phil Murphy has visited both Israel and India, and he has not visited many countries. So I think the fact that the governor has spent time in both countries, the fact that in New Jersey, we actually established from Governor Murphy's visit to India, a trade representative of New Jersey that is permanently in India is another great testament to the fact that New Jersey is leading in the relationship in this very important triangular relationship, with the United States being in the middle. And of course, the incredible work that you are doing, Rabbi Levy and AJC, in bringing all the parties together. You know, I just want to add one more thing, which is that in New Jersey, we are really the heart of the biomedical and life sciences industry of the United States. We heard so much today about, you know, what Israel and India are doing to fight COVID-19 and what we're doing here in the United States to fight COVID-19. And so much of that is happening in New Jersey. I led, and I know that you saw a program, and AJC also led a program about innovations coming from New Jersey on COVID-19. Our biomedical industry is truly one of the greatest in the world, and we are so proud, I'm so proud to be part of this program today to highlight the strength of that triangular relationship as we tackle this global problem together. So with that, I really want to thank everyone here. I'm so glad to join and to be a strong supporter of bringing the Indian and Jewish and Israeli communities together in New Jersey, really a linchpin in the global efforts that are happening to fight COVID. So again, thank you, Rabbi Levy, thank you, AJC, and all the amazing guests and speakers that were part of this program today.
Andrew, thank you so much. It's the partnership that we've had with you and your commission has been incredible. I think one of the things you pointed to that we've been, both your commission and AJC New Jersey have been at the forefront of sharing, if you will, with our state and with our country and our world, is this great triangle that is so clearly a part of the biomedical research that is going to tackle the COVID pandemic. And I think we will look back years from now and know that the work that was done in partnership between companies that are in Israel, India, and New Jersey, hospitals and physicians that are in the three places, we will look back at that and say, the keys were found in the midst of that triangle. I want to thank you for joining us. I want to thank Ambassador MALKA, Consuls General NITZAN and JAISWAL, Doctors JONNALAGADDA, GUPTA, and PARIKH for your participation this morning. Our thanks as well to your organizations and your offices for your deeply valued partnership with AJC's Asia Pacific Institute and with AJC New Jersey and AJC at large. And thank you as well to our audience for joining us and showing your commitment to the topics discussed here today. Please consider making a donation to AJC so we can continue such meaningful diplomatic engagements. You may visit ajc.org/donate and have a great rest of the day. We thank you all.